Coates and I on a phone call. They texted, the head of testing texted back today, said it had been cleared through HHS, and so we'll have sites. I'm not sure where those sites will be. We talked about all of North Texas, some of the needs, not just in Dallas, but looking at some of the needs in the surrounding counties. I've specifically mentioned sites moving on around I-20, but moving relatively closer west, a little more west than Ellis Davis, so that we could pick up from other counties, and also a site that is in one of our red zones in the northern part of the county as well. Also, yesterday had a good talk with all the hospital CEOs about increasing testing, what they could do to increase testing in what I call the red zones. These are predominantly in South Dallas, but there are some Vickery Meadows and other places as well. Talking to the federally supported health clinics like Los Barrios Unidos and others about that as well. One thing about those health clinics that I want people to know that are in the community is those clinics are open, okay? So apparently there's a rumor going around in the community that the health clinics like Foursquare and MLK and Los Barrios Unidos are not open for some reason. Well, they are open, and we want people to get care there. Call ahead if you think you have COVID, but we want you to continue to get care there. We got a lot to cover, but the first thing I want to digress just for a moment, and then I'll explain to you why Phil and I are wearing these good-looking T-shirts, part of our fundraiser. But I want to digress real fast into the census. Dallas County, you know, game on, guys. We are last, dead last right now in North Texas in filling out the census. And that's personally embarrassing to me because I'm supposed to be in charge of us filling out the census. You know, the census is what what determines the sort of federal money we get for things like this in the future. And so public health, roads, schools, you name it, it's based on how many people live here. So please fill out your census. You can go to 2020census.gov, or you can call 844-3, and can you put that on the screen? Oh, it's on there. Okay. It's on the screen by her. Or you can call 844-330-2020. If somehow you forget those, by the way, that's a course in English and Spanish. And if you forget those, you can go to my Twitter or my Facebook. All the stuff will be on there. Or you can go to dallascountycovid.org. The Twitter is @Judge Clay J, and the Facebook is Dallas County Judge Clay Jenkins, I think. So you can go to those places, and all that information is on there. We don't want to send people to your homes right now with all this going on, the door knockers. So please go fill that out, and let's at least catch up with our neighbors in Tarrant County. We don't want to be beaten by Tarrant County, do we? Next thing I want to talk to you about, and we're going to get to the deaths and the number of cases that we've had too, but what we're finding is a lot of small businesses do not know about or understand how to access the Paycheck Protection Program. So want to do that for you real fast. We'd hope to have an SBA person to do this for you, but right now they're kind of in a situation, a gag situation, where they can't come out and talk. So I'm doing this for them. So it's up to $10 million per business. It's a 2-year term. It's a 1% interest rate. But get this, small business, if you retain your employees for 8 weeks, after the loan's dispersed, it'll be forgiven. This is done not through the SBA, but through a bank. For a sample application, you can go to www.treasury.gov. And by the way, I called a friend of mine this morning who owns a small business. He's got like 4 employees. And I said, hey, man, how'd your loan go? And he said, yeah, he didn't know anything about it, right? So he called his bank, and he was able to get that done in 2 or 3 hours. And if you're unbanked, you can still get that done, but you'll do it through a bank. The other loan programs are available are the Economic Injury Disaster Loan Program, and this is also a government loan. Here's the facts on that. Businesses and not-for-profits can apply. The amount's up to 2 years. The term is 30 years. The interest rate is 3.75 for businesses and 2.75 for not-for-profits. nonprofits. The deferment, where you don't have to pay anything, is 1 year. And the forgiveness is up to $10,000 or $1,000 per employee. And for a loan of over $200,000, you have to have collateral. And you apply for that. I don't know if that's back there. Yeah. You apply for that at sba.gov/disaster. Okay. More news you can use. Let me talk to you about child care. Okay. So let me reiterate that everyone who can stay at home must do so. This is critically important this week. All right. And this is a national message. It's critically important this week, but it's also important here. And this applies to adults as well as children. And while essential workers must continue to work outside the home, they should arrange for the care of their children in their own home or with a trusted or nearby relative or friend. As a very last resort, essential workers who have no safe, viable options for the care of their children in their home or with a nearby relative or friend should place their child only in child care centers that meet the CDC COVID-19 prevention guidelines and guidance issued by the Texas Health and Human Services Commission. This is the Child Care Regulation Guidance for Open Daycares. Child care centers that remain open are only to serve the essential workers and must meet the new CDC guideline for safety. Any child care center not serving children of essential workers should not remain open. Any child care center that is unable to implement the CDC guidelines should not remain open. And again, that is a state and national message, but it is very, very important for us to do that here. And now I want to tell you why we're making this fashion statement today. Here's my fashion statement, okay? If you buy one of these good-looking green shirts, it says, I don't know what it says because I can't read that way, but it's from the Dallas Stars. It says something about, you know, the stars and green and quarantine, and those words are in there somewhere. Okay, here's the thing. You buy the shirt, and all the money goes to our Dallas County COVID Response Fund. And speaking of people that are stepping up, I think I've already mentioned that Mark Cuban, well, no, that was a different thing. So Mark Cuban's donated some more money, to $50,000 to help produce mass sanitizer. And then Mark's donation has been coupled with another $50,000 from an anonymous donor to the response fund, which means more frontline responders will get critical resources fast. And it's not just big-time community heroes like Mark and the Stars that are stepping up. One more speaking of big-time community heroes, don't want to leave anybody out, and I'm sure I will here, but also Mary Kay, the cosmetics folks, has stepped up and become a hand sanitizer factory, and they are donating tons to us as well. It's not just heroes like them, it's also just everyday folks who are donating $10 and $20 a pop, and in those small, under $20 donations, we've received about $20,000. So thanks to everyone who's doing that. I don't know if we have, I don't think we do. So the Stars are our community hero for today. We were hoping to have a link. I think it's hangerhockey.com or .org, I'm not positive, for their foundation. But you can go again to my at Judge Clay J to the Twitter, or Dallas County Judge Clay Jenkins on Facebook, or hopefully, well, go to those two, because actually we don't have the link on the website yet. There's a problem with IT on that. So you can go to the Facebook or the Twitter, and you can get a link to buy one of these fantastic shirts, and that's another way to donate to the cause. Also want to recognize Goodwill Industries, who has been serving as PPE donation centers for our frontline responders. All right, Phil is going to give us some more information, more information on this. But today we had 105 additional positive cases of coronavirus, and unfortunately we sustained 3 deaths. Those deaths were all older folks, and one was a resident of a nursing home, and 2 others in their 80s. So before I bring Phil up to talk about that, I want to say a couple more things. One, I know some of our cities, well, one big one that I forgot to say is we have been talking to FEMA. Let's talk about food for a second. I forgot to talk to you about food. So 70% of the people that are at our food banks, going to our food banks, are people who've never gone before. And this is getting to be an increasingly serious shortage for us. I just got off the phone on the way actually into this press conference with my friend Tony Robinson, who is our FEMA 6 representative, who's gone to bat for us. I put in a STAR request, first one in the state, to support a food bank, I guess last month. A STAR request is how you ask a governor to ask the feds to get you something. The initial response back was that there wasn't a mechanism to do that under current law. So we've worked with Tony at FEMA to change that law, and we expect the new guidance will be out probably by the time this press conference is over with, so that we will be able to fill those requests. And what we're requesting is $35 million worth of food to be trucked in by our federal partners to replenish the food bank. That's about 35 fully loaded 18-wheeler full of food. That's how much we need just to catch back up. You've been tremendous. You, people of North Texas, have been tremendous. Last Sunday at this press conference, we launched Neighbor to Neighbor, our virtual food bank for North Texas Food Bank, and you've given nearly $250,000 to that effort as well. As great as you're doing, it's not keeping up with the demand, and we need all the help we can get. So I want to thank Tony and FEMA for stepping up, changing the law, and hopefully very soon we can add to the effort that you have on that. Some of our cities and counties, and mainly I'm talking to the cities here in Dallas, have been using some of our smaller cities have been using the scorecard, or no, it's not a scorecard, but using the numbers of people who are sick in other cities as a scorecard. Viruses don't work that way. We're all in this together. The fact that one small city has more cases in it than another does not mean that that city is doing anything any different. All the cities are following the same rules that are set out in the order, just like you are, so please refrain from doing that. We are all in it together. Before Phil talks to you about nursing homes, because that is a bit of bad news today, I want to say this. Today's Good Friday, and I'm similar, not equating your suffering to Good Friday, but Good Friday was a day of darkness and death and despair and hopelessness. But then Sunday came, right? Your Sunday is coming, okay? And we're going to get through this. And a lot of you guys are feeling desperate and unsure. And if you go to DallasCountyCovid.org, there are people there that want to help you. There's a phone number that you can call, that you can talk to people free of charge. There are links there to get food, to get all sorts of things. And so these times are uncertain, but our Sunday is coming. We're going to get through this, just like the people in 1918 got through the measles epidemic. We'll get 18. We'll come out of it, and we'll be stronger after this is over. So with that, I'll get Phil to fill you in on the nursing homes, and we'll take your questions. Phil.
As the judge mentioned, today we're reporting 105 new cases. What's interesting today, it's actually 1 month since our first case was reported. So our first case was reported in March 10th. And so since then, March 10th, we've had a total of 1,537 cases reported in Dallas County. As the judge mentioned, we had our 23rd, our 24th, and our 25th deaths reported today, and all were older have been hospitalized and underlying health conditions. In terms of the jail numbers and reporting, we're currently at 31 inmates and 2 detention officers associated with the jail. With respect to long-term care facilities, Monticello West, now 11 residents or staff members and 2 deaths. 1 was a new death reported today. Skyline Nursing Facility, 39 residents or staff, no deaths. Edgemere, 10 residents or staff with 3 deaths. Reserve at Richardson, 7 residents, no deaths. Brentwood Place 1, 39 residents or staff with no deaths. St. Joseph Village, 1 resident, no deaths. Villages of Dallas, 1 resident, no deaths. Brentwood Place 2, 6 residents, no deaths. We have a few things. Okay. This was the latest cases by date of test collection. The bar charts are divided into those non-hospitalized, which are the blue parts of the bar, and the red are the hospitalized cases. It goes up the last several days from the 5th on. There's still sort of a lag period as we're getting all the reporting updated. And the line is the cumulative number of cases, getting up to that 1,500 that we talked about earlier. Let's see, that's 1,537. But you can see, you can see the shape of it. It's we've been having, now lately around 100, a couple days lower. But we are definitely, getting the sense that the sacrifice, the judge's orders, everything is making a difference. But it's dependent on us continuing to be vigilant in all these, in practicing the physical distancing. We've talked about, we've been convening many of the modelers in our community to discuss. There's, general agreement. We're looking at a peak towards the end of April, first week of May, but that keeps changing, and we're all looking and processing all the new numbers into this. Maybe next slide. That was a slide the judge had tweeted a couple days ago, just to show how that doubling time, if it had kept on being every 2 days, what that chart would look like. But that instead, after restaurants closing, shelter at home, how it sort of really moves that curve in the number of cases. And so this is the type of chart we're still trying to update. Next slide. This is our latest zip code map as of yesterday. The hot area is at now 75227, has the most number. We continue to monitor those. We continue to then try to go into the community, see what's going on there, work with the store owners, make sure everyone's complying with the orders, but then also implementing the physical distancing. And are we able to try the link? I think today is our launch of the website, which will have more of an interactive map that people can go both for the zip code, and so you can click on or touch over the zip code and see specific numbers in various zip codes, as well as then by city. So I think if you go down further, then there's the city map, where again you can get city specific. Although just remembering all of our numbers are for Dallas County, so sometimes those borders go across the county, and so that's still a limitation of the way the numbers are. But this is continuing to be evolving also, but this is our first, I think, launch of the website to get those numbers out there in an interactive mode. And I'll plug the T-shirt too. That's a good cause. So, thanks.
What questions, if any, do people have? Yes, Allison.
Can you start with talking about Walgreens and what you do know? It sounds like it's limited information at this time, but which Walgreens locations and what that would look like?
Sure. So the question was about Walgreens. The locations will be determined on Monday, or we'll have something on Monday. It might be Tuesday, and it would probably be existing Walgreens in all likelihood. And this is not, as earlier was reported on national news, it's not 3,000 tests per site per day. So it is some test. I'm not sure how many it will be, but it's some test. They're doing it, they were doing it in 50 locations in the United States, and now as they add North Texas, it'll be 52 or 53 or however many I can get out of them for North Texas. And we'll have more information on that on Monday on Walgreens.
What are the areas that you're most concerned about to get these testing sites
So,
up and running?
The areas that I'm most concerned about for these Walgreens sites are South Dallas, not South Dallas County, not necessarily South Dallas City. It could be, you see, it depends on also where the Walgreens is. We have to choose from Walgreens, right? So, but south, and then there is one area that is a community health needs assessment red zone. Actually, there's two, there's several, but there's one area in the north that we're looking at that is both, has a lot of uninsured and a lot of people with these comorbidity factors. So we're looking at that, but it also has some decent access for people in Denton and Collin County. So, they can come get a test there too. So,
I have a woman
Yeah.
writing, she said she got tested on the 26th, she hasn't gotten results back. She can't go back to work until she gets the results of the test. And she said she went back to the testing site because her husband had to get tested as well. And she's saying she was told that they're going with first responders first, and they have kind of a list of people who have priority as far as getting the results back quicker. Is that a thing? Is there a process they're following to get these test results back to the citizens?
so the question was about how, is there a process where some people are put ahead of others at test sites, and why is it taking so long to get back test results for some people? Can I ask you what type of a test site, or where was that test site?
She just said Dallas.
Somewhere in Dallas. So I can't speak to what every test site is doing on that. I know that the lag times are way too slow. The reason I'm trying to get more visibility now into the areas that lack insurance is those areas are liable to have more community spread because people don't go to the doctor and don't have access to testing as much. But this testing issue is going to be very, very important right now to stop. If you think of the coronavirus, to use an analogy, like mosquito larvae, okay? If we can get a dunk in the water now, if we can get a handle on it now, and it's really almost too late for that, but it's never too late, but it would have been great if we could have had the sort of testing that Korea had and a lot of these other countries had, 3 months ago or 2 months ago. But if we can get a handle on it now, and Dr. Fauci had some promising news about that in his conference, but if we can, but that's probably a week away. But if we can get a handle on that now, that's going to help us not having more people get it, and it's going to shorten this up so we can get the economy turned back on. Now, as we turn the economy back on, what do we need as we turn the economy back on? Well, it turns back on in stages, right? And so you've got to do a lot of testing after that first group goes back to make sure you're not seeing an uptick, so we don't have to do this all over again. But we don't have the testing right now to do that, and so we're doing as well as anybody in the United States getting the testing resources here. But obviously this country is way behind other countries in testing, and that is really hurting our efforts.
What's the status of the K. Bailey Hutchinson Center? I know you said that would be a resource once the hospitals are full, but then you also said that it will be a step-down facility. In the event that the hospitals don't reach capacity, how is that center going to be used moving forward? Where does that stand at this point?
Okay, so where it stands, it's really no different than where it has stood. We will use it when our hospitals reach a certain capacity until, this is about the K. Bailey Hutchinson Center and the medical facility that's now been placed there. We'll use it when we don't have hospital capacity, or when our hospital capacity reaches a certain level and our hospitals under that unified response, unified health system response that I have Peter Urbanowitz overseeing, as those hospitals collectively come and say, Judge, it's time for us to send some people there, then we'll send people there. Is that, when is that? Probably, several days to maybe even 2 weeks from now. But that just would be a guess, a guess on that. I'll tell you one thing about PPEs that I didn't mention. The situation with PPEs is very low. I think y'all might have seen some information of people reusing PPEs pretty much everywhere. We are trying to address that. There's a lot of community heroes that have stepped up. I know it's frustrating if you're one of those heroes and hadn't heard back, but the hospitals all have your information. And we will be trying to get back with all of you. We had a situation, two friends of mine from Baylor, actually, from when we were in school together, Mike Singletary and Kenny Hansmeyer, who know about as much about PPEs as I did a month ago, were able to come to our aid through friendship, and they're able to find several 100,000 N95 masks at about half of what we've been paying for them. So we will be, buying those. So we want people to keep coming forward. You guys like, Mike Singletary through the NFL, the Hall of Fame, and San Francisco community stuff when he was a coach there, and Chicago, has a ton of contacts. So all you people with a ton of contacts that aren't such good friends of mine that you just call me and volunteer to help, please help, okay? We need your help. We need PPEs. Yeah.
Can you again talk specifically to the Black and brown community? I know you touched on that, and you said you want more resources, essentially south of I-30, I guess you would say. But what does that actually logistically look like? When you talk about getting resources into Southern Dallas, what does that mean? What does that look like? How soon can people there expect to see, the resources that you're speaking of?
Well, so the question is about resources into the predominantly black community, okay? And that is what we're talking about. When we're talking about Walgreens, when we're talking about my talks with the hospital CEOs and other things, it's about getting, and the resource we're talking about, guys, is testing, okay? Trying to get that testing there so that we get visibility into what's actually happening for people who aren't going to the doctor, because in this state, we don't provide coverage, even though the feds pay for it, for people who make, $12 to $20 an hour, okay? So trying to get that visibility before that becomes a reservoir disease and it spreads through that neighborhood. Now you're seeing in one of those neighborhoods with high uninsurance, that's our darkest color up here now. And so you're going to see more and more of that. Now, one of the reasons you're seeing, by the way, that one be the darkest color, dark is not good on the map, is because there's a nursing home there, and this stuff spreads like wildfire through nursing homes. But it also spreads, and you're seeing this in Detroit and New York, it also spreads through neighborhoods who don't have access to quality health care. In those neighborhoods, they have the good sense to take the Medicaid expansion money. So we're talking about healthcare deserts. Even though there's an ability to pay, they just don't have as much health care in those neighborhoods as they do in other neighborhoods in Detroit or San Francisco or New York. But we have the double problem in that there's no ability to pay for these folks because the state hasn't afforded them their fair share of the coverage under Obamacare, Affordable Care Act. So when the healthcare community can't get paid, right, then they do what they can, but they can't do much to build facilities there. So we are in a worse situation than other areas. We're acting aggressively, that's helping, but we're in a worse situation than other areas to protect the people who work in our community. These are people who are not sitting at home. These are the people who work in our community, do the jobs that the rest of us benefit from, and we've got to do more to protect them. That's also the best way to protect public health. You don't protect them, then we won't be coming out of this because you'll just keep getting sick. Yes, ma'am.
Speaking of the nursing homes, we have a death
So the main thing that's being done to protect people in nursing homes is, the nursing home staff are following the guidelines for nursing homes. But if you want to get a loved one out of a nursing home that's COVID positive, we will, we have only a tiny amount of what are the fast tests, the 1-day turnaround tests, like, a dozen to 3 dozen a day of those, okay? So we just don't have a lot. But we will use those on your loved one if you want to take them out. Now, if it's just, I'm curious, understandably, we're all curious, right, in these uncertain times. If my loved one has it in the nursing home, but they're going to be there, staying there anyway, then if they're, symptomatic, qualify for a test, we can get them a test, but it won't be one of those few 1-day turnarounds. But what we want to do is, if there is a place, and each family's different, each health condition is different. If there is a place to in the house, in a home somewhere, for people who are not sick yet in one of these positive nursing homes, then we'll help you get your family member out. Beyond that, we'll ensure that the nursing homes follow the COVID guidelines. And of course, if you're just worried about maybe getting your loved one out of a nursing home for a time that hasn't had their first COVID positive yet, you can go pick up your loved one whenever you want.
Are there people inspecting these nursing homes to make sure that they are following the guidelines, or how is that being done?
The state has inspectors. It's very poorly funded in even the best of times, and the inspections are not, as robust as you would hope. And now, with everything that's going on, resources are even more stretched. But we are taking it on ourselves at Dallas County to do some looking in and working closely with the nursing homes. And remember, the nursing homes and the people that work there are healthcare heroes too, right? I mean, you think about the people at Brentwood 1, and they got over 100 people that are positive in just that one building. So they're working very hard to keep as many people alive as they can.
Back to the Black and brown communities, I know nationally they said that it's difficult to track. It's going to be difficult to track race when it comes to who's being impacted by COVID-19. What about Dallas County? When this is all said and done, are you all going to have some pretty solid numbers and trends looking at African American community and the brown community as well? And is this something that you all could foresee coming? I mean, as this was starting to creep into Dallas County, did anyone think, or was there a discussion, we're going to have some areas predominantly south of I-30 that are going to be hit really hard. Was this something that you had some foresight into as well? Okay,
so several questions, and I'm going to repeat those. One question, or there are 3 questions, they all stem around the same thing. There's some uncertainty in the national numbers about the impact on the black and brown community. Will we have good numbers coming out of this on the impact on our black and brown community? And did we have some foresight into this negatively affecting those communities more so than other communities? And so I'm going to try to address all those. The numbers on the national level, everything is moving quickly, but here's the number people need to know. Our nation is 18% African American. Our hospitalizations nationally thus far are 38% African American. You don't need to wait for a bunch, and the numbers are not quite as stark, but they are not nowhere near as good for Anglo and non-Hispanics. Hispanics are not as disparate as the number I just read to you, but it's also affecting that that group of people, those neighbors. So we have enough data right now to know that we need to flood the zone and help those neighborhoods and help those people. Okay, will we have good data coming out of this? I hope so. We have PCCI in the hospitals and Dr. Wong working on that as one of the key things that we're doing. Did we have some foresight into this? Well, here, yes and no. Yes, we know that whenever there is a health condition, that disproportionately affects those who are uninsured We see that all the time because we're the metro area with the most uninsured in the United States, again stemming back to our state's decision to not insure people who can't afford. They don't make enough to get the Obamacare subsidy, but they're working. So we knew that, and we began to work on that from day one. And we knew that there's more diabetes per capita in the black community and the brown community than in the white community, and we knew that diabetes was a danger. We knew that heart disease early on was a danger, and we knew also there was more heart disease in the black and brown community. What we didn't know are some of the things that have just been discovered and released by medicine nationally, that this, even more so than other diseases, is discriminate against black and brown neighbors. And so that makes it even more urgent that we get that help there as quickly as we can. It's not a matter of, let me make this clear, it's not a matter of the county or the state spending money that they won't give me the money to do it. It's not that. It's the fact that there's not enough testing for when I find people that can do it to get the testing that we need to protect those communities. And that has to change. Meanwhile, similar to a guerrilla war, okay, it may not be enough testing, but we're going to get every bit of it that we can get. Yeah.
There's some national reports today that the president is talking about wanting to open things back up sometime next month. I know that we're talking about us peaking late this month, possibly next month. Does that tell you anything about when we could begin opening things back up again? And what are you going to look at? What will the factors be that you'll consider in opening up again?
Sure. So the question was, when, basically, after we peak, when would the government...
Does that tell you anything about when we could open back up?
Okay. Does the information, and I'll be honest, I didn't see the president's news conference. I was on the phone with Walgreens, actually, during his news conference. But so I can't answer that information in his news conference told me anything. What I can say is that our medical models from our hospitals, that is a consortium of UT Southwestern, Medical City, Baylor Scott and White, Parkland, PCCI, and Dr. Wong, and perhaps others, and looking at these models, project that our peak would be sometime in early to mid-May. Okay, so obviously the economy can't open back up while cases are going up, and then what the tail looks like remains to be seen. Is the tail, if you think of it like a curve, okay, right? So as we're going down, at some point you can open up some of the economy. And so we can look at what other countries have done, okay, other countries that are further along than us that looked and saw what to open up, opened it, and saw that it didn't have a problem, and other companies that opened it a little differently and had a problem. Our doctors will look at that. Our business community will look at that. A ton of people will advise me on that. One of my advisors will be Robert Kaplan, the head of the federal bank here, as well as many other folks from small, large business and medicine. And so we would open a segment of the economy, test it for a couple of weeks, open another one. When that is, it's probably too early to say, but people are working on it even as we're here today. Thanks.
Probably June, it sounds like, by the earliest.
It's really hard to, I'm not holding back. The question again was from Allison was, when would the economy likely open back up? I'm not holding back from you or the public secret information, okay? We're looking at it very closely. Nobody wants this nightmare to be over with, frankly, more than I do. Any last question, and then we'll just, yes, sir.
You talked about the situation at the hospitals right now, and then my other question was if you have a message for the people for this weekend. I know in Tarrant County they're being pretty strong about not wanting anybody outside to the point they're going to be patrolling and trying to identify those areas where people are gathering. Can people expect that here?
Yes, yes, they can. The first part of the question was about the hospitals. What was it about the hospitals? I'm sorry.
Yeah, just the situation. How is the bed capacity?
Oh, okay,
currently?
sure. So our hospital bed capacity count continues to go up, but it's still very manageable. This is a question about bed capacity, obviously. It's still very manageable in the 50s, okay, And so, that, but it has gone up, 4 or 5% this week. But that's still in a very manageable, good place and better than earlier models predicted. Certainly the models before we went to this aggressive posture of safer at home. My message for this weekend, we talked about the analogy between what you're going through and Good Friday. This is a special weekend for so many families. It's Passover for our Jewish friends and neighbors. It's Easter for Christians. There's holidays in other religions this week as well. And so it's a time where families normally come together, right? I know in my family it's a time where everybody is either at my house or Mimi and Poppy's house, right? And everybody brings a dish and we all see each other. And, so this Easter, this Passover, it will be different, but it need not be less special. And whether it's Zoom or whether it's just synchronizing that you're all watching the same service at the same time, or you're talking to shut-ins on the phone, it can still be special. And so I want it to be for people. Now the parks will be closed in the city of Dallas. And we will be trying to make sure that they're not large gatherings, okay? And you may have a big family and you may say, well, everybody's going to come over to Mama's house and there's 20 of us and we're all going to, get together. Well, that's a congregate setting, right? That's not safe. It's not safe for Mama and it's not safe for you, right? And remember that a lot of the people who have COVID out, and that's one of the challenges of getting these tests out there, are asymptomatic. So you may go over to Mama's house and not know it. One of your kids may have COVID, and then Mama gets COVID. And we don't want Mama to get COVID, right? So as tough as it is, we need to stay in our own homes, but still reach out and touch through the phone, through the Zoom, the people that we love. And that's one of the ways we'll get through this, and we'll get this over with faster. And both in my capacity as Dallas County Judge, and then just as my capacity as a member of the Jenkins family, from my family to yours. I hope you have a very, very blessed holiday weekend, and you find special moments even in the midst of this very weird situation that we find ourselves in. God bless y'all.